We are now going to cover the application techniques and safety considerations for radial shockwave therapy. For patient positioning, the patient should be able to remain comfortable and relaxed throughout the treatment with the targeted treatment area fully exposed. The patient can be positioned using pillows or supports if needed for stability and comfort. Depending on the lesion, the patient can be seated, for example, if the shoulder is being treated, or lying, for example, for treatment of Achilles tendinopathy. Skin preparation. The majority of the time, no special skin preparation is needed, but cleaning the area may be required if the patient has applied lotions or oils that may reduce grip. Always apply ultrasound gel or the gel recommended by the device. This improves transmission of the acoustic waves. The gel you use in radial shockwave therapy matters for both treatment effective and patient comfort. The purpose of the gel is to ensure efficient transmission of the shockwaves from the applicator head into the tissue. It eliminates air gaps between the applicator and the skin, which is important as air blocks energy. And the gel also reduces friction and heat at the skin-applicator interface, which helps improve patient comfort during treatment. Regarding handpiece placement, hold the applicator perpendicular to the skin for maximum energy transfer. Keep firm but comfortable contact. You do not need to press the applicator excessively hard onto the patient. The energy comes from the shock waves, not the mechanical pressure with which you push the applicator onto the patient. Make sure as the therapist that you are also comfortably positioned and holding the handpiece comfortably in a way that allows optimal control. How you hold the handpiece may vary for each condition. The handpiece can slip during treatment, particularly when treating areas such as the Achilles tendon, which is why it is important to adapt how you hold the handpiece to optimize control. Targeting the correct tissue. Identify tender points or the exact area of pathology. Sound knowledge of anatomy and good anatomical landmark palpation skills help with this. Move the applicator slowly and smoothly. For tendons, you can hold the applicator still over the painful insertion. For dosing, refer to the treatment protocol section of this presentation, but you may want to consider the following general points. Start with lower bar and moderate hertz. Adjust these based on the patient's feedback regarding their tolerance to the treatment. Watch the patient's face for discomfort. They should feel strong pulses but not unbearable pain, and they should not be shouting out in agony. Treat until reaching the target number of shocks, for example 1,500 to 2,500. Safety considerations. Again, refer back to the earlier section on indications and contraindications for a detailed analysis, but screen the patient for absolute and relative contraindications to ensure it is safe to proceed with shockwave therapy treatment. Consider the noise exposure for the patient, but perhaps even more so for the therapist, especially if they are completing several shockwave treatments in a day. The shockwave device makes loud clicks. Some clinics provide ear protection. To ensure it is safe to proceed with multiple shockwave treatments for a lesion, watch for adverse effects. Mild bruising and soreness for 1 to 2 days is normal. Excessive pain, prolonged swelling or hematoma is not. Check the settings and treatment technique and adjust as needed. Avoid treating immediately after a corticosteroid injection. Allow 4 to 6 weeks to elapse. Also remember to clean the applicator by following the manufacturer's guide. Tips for best practice. Always explain to your patient what they can expect. The patient should understand that it may be uncomfortable but safe. Make a record of the consent process. Document the treatment parameters used in each session, including the bar, hertz, and the number of shocks delivered, and also remember to document the patient response. Progress treatment settings gradually over multiple sessions. Do not start too high. Combine shockwave therapy with rehabilitation exercises for best long-term results. Radial shockwave therapy is not a standalone cure. The bottom line is proper technique and correct patient selection, along with safe settings, results in maximum benefit with minimal risk. Throughout this presentation, it has been highlighted how radial shockwave therapy is primarily used for chronic, more superficial musculoskeletal conditions that have not responded to other conservative treatments. Examples include plantar fasciopathy, Achilles tendinopathy, patella tendinopathy, rotator cuff tendinopathy, and tennis elbow. Thank you for your attention. If you are considering adding shockwave therapy to your clinic, please get in touch with the team at Eureka, who will be happy to discuss device options and implementation strategies.